Hello, welcome everybody. We'll give just a brief pause to get everybody logged in and we'll jump in. Seeing our attendees number starting to rise, so we'll kind of go ahead and jump in. Welcome everybody to September's Research and Discovery Grand Rounds. We are already heading into the fall season, so we appreciate everybody's attendance and we are extremely excited to welcome our very own Frontiers KL2 training program co-PIs, Dr. Nikki Nolan, professor of population health, and then Dr. Matt Mosconi, professor in clinical child psychology. We're going to discuss the NIH peer review process, and then including any updates and changes to our reviewer guidelines as they come along. So with that, we are very appreciative of our speakers, and I'll let you take over the slides. Thanks so much.
Okay, thanks everyone for joining. I just want to verify that you guys are still seeing my screen, right? Is that correct? No.
I think you're going to need to reshare, Dr. Nolan.
Reshare. Okay, share screen. Sorry. Now?
Yep. Good.
Okay. All right. Thanks everyone for joining. Just wanted to let you know that I think that this will be a fairly brief presentation by myself and Dr. Mosconi, and there will be plenty of time for questions at the end. So hopefully you have come prepared with questions. So today we're going to talk about the review process and procedures. I think many of you probably already know this, but it's worth reiterating some key facts related to the review process, and it does kind of help you think about how to write a compelling grant application. And then we will talk about the pass and new criteria, what the rationale is, and we'll provide a bit about the review template and the summary statement template. Okay. So just to be clear, the review criteria have changed, but the core application components have not changed. So that I think is really important. So the core application components are still specific aims, significance, innovation, and approach. We've got the specific, what are each of those per NIH down below. So this hasn't really changed the way you write your application, although it has changed the way the applications are reviewed. So just to go over the review process quickly, and again, I think most of you know this, but it's good to revisit. So there are 2 levels of review. It's a 2-tiered system. The first level focuses on the scientific quality of the grant or the merit. That happens by a study section of your peers. And then but study sections don't fund grants. They review merit. The next level is the NIH Institute or Council. And that's composed of, currently composed of, if I move this over here, do you guys now see the screen? I'm going to minimize it. There we go. That is composed of scientific and public representatives chosen for their expertise. I am going to say that there was an executive order. I'll let you guys read this. That was issued on August 7th. That would move the authority over the funding decisions away from the institute or centers towards the political appointees. So I think that is still, at this point in time, up in the air. Okay, so the process is that NIH assigns, you submit a grant, it gets assigned to a SRG, which is a scientific review group, and an appropriate institute or center. You'll get an email when that's assigned. I will say that it's very important to check ERA Commons and be proactive that the SRG assignment is the right fit for your application. For those of you who have submitted recently, I will note that you can submit a request form, study section SRG request form. And in the past, NIH has been quite good about aligning with what you're requesting. I've had some issues recently. I think that the Institute is just in general in somewhat of an upheaval. So I have had to go through the process of requesting that the SRG be reassigned. And they are very responsive, but just really pay attention because that does matter. So then once it gets assigned to a study section, that study section is comprised of 20 to 30 scientists. I think that varies depending on various things, but each application is assigned 2 to 3 reviewers. There is a pre-review process where the reviewers go through the process of reviewing the application. They prepare the written critique, which is, Matt will show you that a little bit later in this presentation, and then a preliminary score. So the 2 to 3 reviewers, there's a first, second, and third primary, secondary, and tertiary reviewer assigned. All of those reviewers submit scores for each section, but they also assign an overall impact score. And it's that overall impact score is what is used to determine if your application is discussed or not. This overall impact score, and I'll talk about this here in a minute, is also the main score that comes out of your study section. So if your overall impact score, based on the 3 reviewers who were assigned, 3 or 4 who were assigned your application, has you in the lower half of the applications that are being reviewed in that study section, your application will not be discussed. It's called an ND, unless one of the reviewers votes to rescue your application and have it discussed. So if your application gets triaged, you still will receive a written critique. You'll get the summary sheets from the reviewers. What you won't get is the summary of discussion, because again, your application is not being discussed. So just, I think it's helpful to know actually what happens at study section. So we spend months on these applications, months. Reviewers do spend a lot of time reviewing the applications to get to the study section day. But in study section, those applications are discussed for 15 minutes or less, right? So I think that's important to keep in mind, and that's 15 minutes or less for an R01 and less than 10 minutes for some of these the smaller mechanisms, the R03, R21. So in study section, the chair asks, there's a chair of the study section, they ask each of the 2 to 3 reviewers to state their overall impact score. So that's either a 1 to 9. And so then the first reviewer is given 4 to 5 minutes to summarize the application and to describe the overall impact, and then major score driving strengths and weaknesses. That's important. Those major score driving, so they can't get into the nitty gritty weeds. It's major things that came up for them that drove their overall impact score. That is limited to 5 minutes generally. The second reviewer is asked to add anything, again, focusing on overall impact, and then differences or disagreements with reviewer 1. They are given 2 to 3 minutes. So that's a typo. Reviewer 3, same thing. So by the time it gets to reviewer 3, they may have very little to say because reviewers 1 and 2 have already addressed their score driving strengths and weaknesses. Then it is opened up for discussion. This is where non-reviewers are able to ask questions that will help them determine their overall impact score for the application. And the discussion is limited to 3 to 5 minutes. Okay, so then the chair asks the primary reviewers to restate their overall impact score. So this then creates a range of score. So based on the other reviewers and the other primary reviewers and the discussion, this is where scores can often change. So they might change their score based on that point, and it is that score, not the initial score, that matters. So if a reviewer gave your application a 2, which is a strong score for the impact, but other reviewers were less favorable and the discussion was less favorable, they may change their score to a 4, and it's that 4 that you're going to see that goes into calculating your score for the grant. So each of the reviewers does that. The chair states the range for the overall impact score. If someone is going to vote outside of the range, they must declare that and state the reason. And then everyone will submit an overall impact score. So there's 2 to 3 people who have read your application, but everyone in the study section provides a score. So under the simplified reviewer framework, which we will spend the rest of the presentation talking about, each application is scored on 3 criteria. It used to be 5, but now it's 3. So it's important of the research, which is combining the old significance and innovation. Again, and everything is scored 1 to 9, with 1 being exceptional, 9 being poor. The second core criteria is rigor and feasibility. That is the approach. And then the, I'm sorry, and there's a typo here then. So they're actually scored on 2 core criteria, because expertise and resources, which is a combination of investigators and environment, is not a scored criterion at this point. It is just you mark the reviewers from a drop-down box, mark sufficient or non-sufficient. And if it's not sufficient, they are asked to justify why it's not sufficient. But it's important to note that these categories are not weighted equally, and reviewers can decide how much each contributes to their overall impact score. So for some people, you know, innovation may be weighted less in their mind than other things, and vice versa. So then the 2 core criteria are, which is the importance and the rigor, are used by the reviewer to determine their overall impact score for your application. So then the main number that comes out of the peer review process is this overall impact score. And this reflects the reviewer's assessment of the likelihood of your project to exert a sustained and powerful influence on the field. That is very clear. And when reviewers are writing the overall impact statement, that is what they are being asked to really think about in determining the score for your application. And so then the score you see after your review is an average of all the panelists times 10. So the range is 10 to 90. So if your grant in study section gets an average of a 2.1, you got to take that times 10. And so the score you're going to see when you log into ERA Commons to see how your grant scored, you're going to see a 21. And the scale here is shown, you know, with 1, 2, and 3 reflecting applications that have high importance or impact to the field and very few weaknesses. Scores in the 4, 5, and 6 range have high importance in the field, but there are some weaknesses, or they might have moderate importance. And then scores here in the 7, 8, and 9 range are just not believed to be very important in exerting sustained and powerful impact. And there also may be numerous methodological weaknesses. Reviewers are encouraged to use the full range of scores, meaning a good medium
the lunches, and it's really, really good.
What?
So,
oh, Matt. So anyway, 5 is a good medium impact application, and then reviewers are encouraged to use the entire scale, 1 to 9. So I'm going to turn it over to Matt now.
Great, thanks, Nikki. So I'm going to dig into the specific criteria that go into these overall impact scores that will drive decisions around whether grants are funded or not. I'm going to start here with a pretty significant, or at least superficially significant, reorganization of the criteria that are used to evaluate our awards. And so what you can see here is that most of us who have been writing grants up to this stage or written previous Rs are used to these 5 criteria: significance, investigator, innovation, approach, and environment, each being scored and each contributing to varying degrees to the overall impact scores that we receive then as grant applicants. These criteria have been reorganized into what you see on the right side of your screen into 3 criteria, 2 of which are then actually scored. The reality from my perspective, and we're relatively new in this process, to be clear, this is this past year that this reorganization has occurred. All of those criteria that we previously wrote to and reviewers considered are still embedded, baked into these 3 different factors. They're just organized and then evaluated somewhat differently. The biggest change being that factor 3 is no longer scored. And I'll talk through sort of the rationale for this reorganization, and then the extent to which this should be or could be integrated into your actual preparation and your writing up of your proposals. So Nikki, if you want to go to the next slides. I'll go through the next 2 slides pretty quickly. In short, there are multiple additional review criteria that reviewers will comment on during the discussion, but in their own section. So they'll be somewhat separate than the discussion of the major score drivers. And these particular, on this slide, these particular areas are not actually scored. They are just considered by reviewers. You'll see there human subjects protections and then the inclusion criteria. Human subjects, you will have to write out, if you're doing human research, you will have to write out essentially how you are going to ensure safety, ensure compliance, and things like that. It's not the actual IRB. You don't need the IRB approved before you're submitting grant, but you do need to write out where you're going to find people, how you're going to recruit, how you're going to protect them at levels of risk, and things like that. The inclusion of women, minorities, and children. These are sections that have been included for years within the review process. There have been modifications to these inclusion criteria in terms of how they're considered. You can see the link there that describes these modifications based on changes at obviously at the federal level. And the reality, though, is as I read them and see them coming through, they have, I don't see them amounting to that much change in how we're conceptualizing. Of course, I believe we've all been hearing about words that we should no longer use in our grants. I think there is keep going back, go back, please. There is a take-home point there that the inclusion of women, minorities, and children within the research is something that you need to be thinking about, of course, in terms of developing your proposal, and that you just need to justify scientifically. Okay, so what is the data to inform including or not including this particular, based on sex, race, ethnicity, and those things. So if you can develop your data-informed argument, it seems that that is in line with these modified criteria around this particular area. Okay, now you can go to the next slide. These other components, again, these are things that we can talk about if people have questions about them in the Q&A portion, but I'm just going to fly through them. These are things that you obviously have to address within your proposal, but they are not scored. They're simply noted, and they typically are relatively either templated or straightforward types of sections. All right, now you can go ahead. All right, so this reorganization from 5 criteria to 3 criteria, the idea behind it was to place greater emphasis on the science itself to mitigate, as you can see in that last bullet point, the impact of reputational biases around either the investigator or investigators or the environment within which they're doing the research. In other words, certain investigators were kind of the wheels were greased, and there were biases in terms of evaluation of the grants, expectations that, hey, there might have been this hole, but it's this investigator doing it, so probably okay. those kinds of biases were seeping through, even if not explicitly stated, or at least that was the concern motivating this particular reorganization. So what happened is that those the investigator and environmental components are no longer scored, but they are considered. So to be clear, in all our proposals, we still need to be biosketches, be a description of how we're going to conduct the research. Be mindful that we need to lay out for reviewers that the appropriate expertise to carry out each component of the proposed projects is in place with the team. It can't be this person's famous, they publish a lot, but is they have this specific area of expertise and knowledge, and that addresses this particular component of the proposal. So that still is considered. I don't want people to falsely or to erroneously interpret this reorganization or this discussion about it to suggest that that individual expertise on the study team no longer has significant weight in the evaluation, because it does in that context, but it's aimed to mitigate potential biases in who gets awards. Overall, though, the real key criteria still are, put simplistically, is the research important? Should it be conducted? Do we need this in this particular field in whatever area you're studying? And can it be done? Is it feasible? Is the question, are the major study questions that are being addressed going to be answered in the context of the proposed design with the proposed team? Okay, go ahead, Nikki. So these are the key areas. And again, these are the same areas that we used to write about. From my perspective, and again, we're relatively early on, the reorganization of these review criteria are not changing the way necessarily that we're writing our grants, right? We're still writing about significance, innovation, the approach, and its rigor and feasibility. But these are the key areas. Now, people get significance and impact. They can be confusing in terms of how they contrast with one another. Nikki talked about impact, and that impact score is the key, right? That is the key to determining whether your proposal is going to be within funding range. But the impact is comprised of these different categories, including significance. So one way to think about significance relative to impact is significance is like, is this idea important? Is it addressing critical scientific challenges or research gaps that we have here? Looking at the background, what is known about this particular area? Is there a rigorous analysis of where we are and what is needed? And in that context, reviewers can evaluate, yeah, this is a highly significant project. It needs to be done. It's good to cure cancer. But they're going to then evaluate the approach, its rigor and feasibility separately. Well, they say they're going to cure cancer. Good call. Significance of one, that's great. The approach is just a mess. It's never going to happen. Approach is going to get a lower score, and then the impact is really going to be, is this going to have an impact on the field? Well, no, not if that reviewer believes the study can never be successful. So significance can get a 1, and impact a 7, 8, or 9 in that kind of context, okay? So hopefully that makes sense, but again, happy to answer questions about that, as that is a point of common confusion in going through these different criteria. Innovation, yeah, how novel is this? Now, is it novel in the methods? Is it novel in the conceptualization? Is it a novel theory that is being tested? And so some of us, when we're writing grants, it's okay to separate the different types of innovation. That is, this is a new measure that's never been used, or all the measures have been tried and true, they're validated. That's a strength of the study, but this is a really new way of applying them, a new population to apply them to, a new way of considering A, B, or C. And that innovation could really then be more conceptual than it is methodological per se. But each type of innovation can be evaluated as important by reviewers. So it's important to lay those things out within the proposals. All right, go ahead, Nikki. So approach, of course, the methods of the study themselves are important. And I do believe that there's a strong bias amongst all of us who are scientists in really weighting these quite heavily, right? And so from our first days of developing as researchers, we're learning about study design. Those things are, those details are weighted significantly in most reviews, and they should be. The key areas that reviewers are instructed to focus in on are the rigor and the feasibility around the proposed methods and the proposed designs. That is to say, there is an emphasis, and it sounds like this emphasis is being amplified at NIH, and that is around the idea that the study is rigorous. That is to say, it is going to produce reproducible data. So when I say this might be getting amplified, there are discussions, it seems, at NIH where there's increased attention potentially in doing replication studies, replication data. Now, how that will manifest within NIH, I don't know. Maybe people on this call know, but I certainly don't. But I know that that's an area of focus. It's also an area of focus for reviewers. Is this going to be a one-off? Is this data based on too small of a sample or based on too unique of a sample to really be something that we could rely upon? That is, it could be reproduced and really translate and have an impact. And so that is going to be heavily weighed in terms of the experimental design and all the details of your methods. And then also the feasibility. That is going to be something that every grant is different, but there are very few grants that I've ever been a part of where we're not explicitly talking about why this work is feasible. That is, we will be successful in recruiting this particular population or subpopulation. We will be able to actually apply the methods that we're describing on this particular population. So really laying out the specifics of whether this study will be successful, can be successful, is quite critical, and it is an area of focus for reviewers. All right, and that's the feasibility. That this is more detail about what I was just talking about. But you know, as you're organizing, you know, your proposal, there are multiple ways to approach it, obviously, and to label the different sections of your proposals. But certainly, rigor and feasibility are going to be areas that reviewers are instructed specifically to focus on. And as Nikki laid out, there's very limited time for each reviewer to lay out the case for why these studies should or should not be or are not impactful. These areas will get particular attention in my experience. All right, factor 3, and this is I've already spoken to these to an extent, but this is the section or the new factor that is the biggest change in the reorganization of the criteria. That is the investigators and the environment. Certainly, as I mentioned before, even though this factor is no longer receiving a score, they still merit attention within the proposals. And again, that can be through different components of the proposal, including the biosketches, to demonstrate appropriate expertise for the proposed work. And then when there is a multiple principal investigator component to your proposal, you will be asked to clearly describe how decisions will be made, how the leadership team will work together. All right, so this in the end is what reviewers are asked to do once they've read through the entire proposal, considered the major score driving strengths and weaknesses for each factor, and scored each factor. Then there's going to be a description. I'll show you that in just a moment as we walk through the template that reviewers are provided. But in the end, that last sentence of the impact paragraph is key, and it is a sentence describing whether or not this project is likely to exert a sustained, powerful influence on the research field involved. And you may see that exact sentence on some of the impact paragraphs that you receive back from your reviews. That's key. Basically, pulling all this information together, weighting these different factors to the extent that, or in the way that the reviewer, each individual reviewer chooses to weight them, this is the final consideration that justifies the impact score that's provided. There's a point here that an application does not need to be strong in all categories to be judged likely to have a major scientific impact. So there are examples of this, and they are you see these examples regularly. One example that I see probably more common than others is you can have a really good impact score on a grant that is high in significance, that has a strong approach, high rigor and high feasibility, innovation is just okay. And that is okay. Innovation can be scissor. Each reviewer can view that in different ways. But I have been part of discussions where it's like, well, they're not really doing any new methods. So I'm kind of bored with it. And one reviewer will say that in different words, better words than I just used. But basically, there's nothing truly innovative about what they're doing. I know these methods, they've been used before. And another reviewer may agree, yeah, this has all been done before, but this is so significant. If it actually works with this population, it is so important to the field, and it will get us to A, B, or C. And so innovation just isn't weighted as strongly in that particular evaluation. Under the old rubric, innovation itself would have been specified as being whatever, medium or whatever it is, low, but the impact could still be a 1 or a 2 because the significance and the overall approach is rigorous just really outweigh that lack of innovation. Maybe there's just not innovation needed. It just needs to be done right. And so you can make that argument. So that is my 2 cents on, as you're thinking about, you need to think about your own proposals, obviously, as you're developing what makes the most sense. But that is a better scenario than one where an individual study team goes out of their way because you're worried about that one component, that innovation component, and then you're really pulling in ideas or methods or whatever that derail the project because it's not really what's needed or where the team's expertise and preliminary data lie. So that is just a little caveat on that particular point, but really to point out that it's not simply, the impact scores are not simply an average of all these different categories. They're really weighted in the context of that particular proposal, and they may be weighted differently by different reviewers. All right, so this is the template. This is what all 3 reviewers who do a close read of your proposal will be completing. And so a couple just key areas to highlight here. That at the upper section, I don't think, yeah, my mouse is not seen by you all, but Nikki, if you just scroll the mouse over that overall impact section, right? That is the big one, right? That little, right, that little blank line that's blank right now would be filled up with an integration of all of the major score driving factors for that particular reviewer. So it usually will read, it shouldn't be a recitation of the aims, but it say this project aims to, broadly speaking, or will address this problem. 1 sentence, maybe 2. And then it's going to lay out, here are the strengths, here are the weaknesses, or in this area, this was strong, this was weak, in this area, this was strong, this was weak. But it's, again, as Nikki suggested in some of the earlier slides, this isn't supposed to be a description of every little detail. They studied 25 people. I really think they need 33 people. It is more to lay out. This is significant for this reason. This is why the field needs this. This is really important, but they failed to do this, and it's really important because if they don't do this, X is going to happen, the whole thing's going to fall apart, whatever it is. But that will be the justification for the impact factors, the impact factor that you receive for the overall score. When you get all these back, you'll get scores. You'll see what each of the 3 reviewers scored each of the different factors. You will also get an overall impact factor, but you won't get an impact score from each of the reviewers. Okay, makes sense? So you'll get like a 20, great job, great grant, you get a 20, it'll tell you what percentile, you'll know what percentile that fits within, and the percentile is actually the key in terms of where funding lines are set. And then you'll see all the individual strengths and weaknesses for the 3 factors times 3 reviewers, but you won't see how they weighted it to say this, I gave it a 2, I gave it a 4, I gave it a 3. If you have excess time, and you're like me and you perseverate and sometimes obsess, you might try to figure out what that really meant, how you got that average across the 3 reviewers. Oh, this is clearly a 2, 2, and a 6, whatever. It's not really a great use of time, but just know if you do that, you're not alone. But yeah, you won't get the individual impact factors for each reviewer on this, but they will spell out the different strengths and weaknesses that went into this overall impact. And then, and I don't remember if we have a slide on this. So this is the next one that I do want to talk about. So this will then just, this is actually those were the individual templates that each reviewer will complete. And then what you will get is a summary statement. Some people call them pink sheets because they used to be pink sheets in hard copy form back in the day. But you will get this PDF within 30 days of the review having taken place. Okay, you'll get your score before then, and then eventually you'll get this summary statement, which will lay out how that score was derived. And this is important. This is what you should obsess over as if you're going into a resubmission. This will lay out each of the reviewer's comments, but then above it, if your grant was discussed, there will be a paragraph describing that discussion, and it'll be called the resume and summary discussion, exactly where Nikki's cursor is. And that is key, right? So that is a statement, and that's where there's advantage. There are definitely grants that go from not discussed to first percentile, not discussed to funded. That does happen. If you're triage, it doesn't mean you're sunk and you shouldn't resubmit. But one key advantage of being discussed is you get this summary of the discussion. And that should highlight to you, if it's done well by the chair and then by the SRO, it'll highlight what was discussed, how that went. And those are then the areas that you should be interpreting as the major score drivers, the areas that I want to double down on, remind reviewers in my resubmission how they loved it last time, so you better love it again, even if you're different reviewers. But then also, these are the areas that prevented it from being funded if you're resubmitting it wasn't funded. And those are the weaknesses you probably want to start with in formulating your response. And then you can see where they come from the individual reviewers. And they should be seen somewhere under reviewer 1, 2, or 3's comments, or maybe multiple of them, okay? But that resume summary discussion is going to be really helpful. Even if you don't get that, if your initial submission is triage, going through the impact paragraphs and then seeing how they're described more explicitly in greater detail at the individual strengths and weaknesses bullet points within those for each reviewer is going to drive your response, your resubmission, and frankly, your determination if you do want to resubmit. But the one last point that I'll add to that then is when you get summary statements back, one thing that I always do, and I know that other investigators do things differently. I've heard that they don't do this. I really like to take, once I get my summary statement, email the aims and the summary statement to the program officer. And hopefully that program officer actually listened in on the discussion. And they say, yeah, these are key points. And I had this happen for actually my most recent grant this past, a couple months ago, where they said, yeah, that's what the summary discussion said, but this is what I heard in that discussion. So I wouldn't worry too much about that point. This is what happened, and this was just by one reviewer, whatever it is. They can give you some context as you're thinking through your response and how you want to modify your proposal before resubmitting for the next round. So I do think that that's important. I will say sometimes program officers just don't go to those study sessions. That's okay, especially now. Gosh, they're stretched so thin. Sometimes they don't go, or sometimes they don't have notes, or they send somebody else. And so sometimes, just to be clear, that is not so useful. But I have found it to be useful in certain contexts for certain program officers. So that's all I had. I think that Robin is going to talk through these next points, and then we'll open up to questions.
Actually, Dr. Sanderson Cox will be taking these next 4 slides.
So these are, I appreciate Nikki and Matt, your comments before, and Matt, just building on yours, I'll just say, be open with sharing the feedback and scores that you're getting with your team, because you'll get good feedback. It's a good learning experience for everybody. It's not something, if you don't get a great score, that's not a terrible thing. And it's great to be open in discussing that. Okay, I'm going to just run through some of the Frontiers pilots that we have available for folks, because we are currently in the season of really beginning letters of intent and opportunities to apply and receive some awesome funding within Frontiers. So the first one that we're just going to go over is the Lauren S. Aronson pilot. That's the largest, broadest area for pilots within Frontiers. And I just put in the web or in the chat a link to next week. We're going to be having a talk about translational science. And it's important that there's translational science incorporated into any of the pilots that we support. So within the, what we say LSA pilot, we're looking at processes and programs to understand and support and advance translation. So we're looking at things like collaborative structures or workforce development or integration of project management, education and training, biomarker qualification processes. It's a really, really broad range, but it's with the goal of advancing translation of science, which we'll talk more about next week. We also look in the LSA for data-related improvements and tools, for clinical research improvements and tools, for clinical study recruitment improvements, again, looking for opportunities to advance community and stakeholder engagement and methods to better measure impact on health outcomes. So you might be using a very specific topic as your case, but hopefully what you're proposing and learning would be something that would benefit science much more broadly and translation much more broadly. So the LSA pilot is up to $50,000, and that is coming up. The letter of intent is October 15th. So let's go to the next one, which is our Institute for Advancing Medical Innovation Trailblazer. So you may hear this referred to as IAMI, and you may be talking about people talking about Trailblazer Awards. But there's sort of 4 major areas that are specifically being sought for this $25,000 pilot award. One is in the area of experimental therapeutics trials. And so this is looking at research activities like clinical validation of drug targets, clinical pharmacology, clinical proof of concept of a novel therapeutic, or using an FDA-approved or abandoned drug for a different purpose. And the awardees must have demonstrated proof of principle in validated in vitro and or in vivo preclinical models, if that's your area. They're also looking for drug and medical device development. So this includes generation and optimization of small molecule lead candidates, conducting preclinical safety or pharmacokinetic and proof of principle studies, formulation development, as well as things like creation of prototype medical devices and device testing. A third area is biomarker discovery and validation. And so that's looking into biospecimen collection, patient registry development, genetic, genomic, metabolic analysis of patient specimens, or analysis using established investigational methods to discover and validate biomarkers of drug activity. And the fourth area here is entrepreneurship activities consistent with the mission of IAMI. So looking at things like activities defining the investment thesis of potential product development opportunities, or looking at unmet medical needs, proposed solutions, patient position and strategy, marketing and licensing strategy, and things like supporting support for obtaining key opinion leader input. So that's your IAMI mechanism. All of these things you can find on the Frontiers website for more information. The next one is our, what we call our BIRD, which is biostatistics, epidemiology, and research design Trailblazer Awards. And this is really focusing on addressing methodologies or analyses that would be useful for the study of all diseases. Again, you might be proposing a specific example, but you're trying to advance translation. And these would be things like including academic disciplines such as biostatistics, epidemiology, bioinformatics, data science, and other quantitative areas that impact clinical and translational science. And also non-human subjects research and non-animal studies applications only. So the mechanisms intended for methodological or quantitative analysis development specifically. And more information, all the details of the RFA are on the Frontiers website. Did I mention that one's $20,000 for a pilot? Okay, let's move on to our last one, which is our integrating special populations pilot. This is a $25,000 award, and the ISP pilot supports multidisciplinary translational research that addresses all diseases, but some examples that they've given are things like consequences of maternal, fetal, child, and adolescent disorders on the health of adults and older adults. Also things like supporting transitions of care from childhood to young adult to older adult, so lifespan, incorporating participants who are older adults or rural residents into drug and other intervention development and testing. And then also things like addressing unique challenges of rare diseases and improving access to care and other resources for families in rural and other underserved communities. Again, check out the Frontiers website for more information on all of these. And please feel free to join us next Wednesday for a longer discussion about the differences between translational research, translational science, and some of those key components that you would want to include in your applications. Any questions across any of the topics from today?
Yeah, thank you to our presenters. It was awesome hearing kind of the process and then some of our updates and then the great opportunities that we've got with Frontiers. So yeah, if anybody has any questions, feel free to come off mute or put it in the chat and we'll get them answered.
So Erica has a question. How many panelists are assigned to each study section? It's usually 20 to 30, although sometimes there are standing study section members, but then also there are also what's called ad hoc. And so if there are applications assigned to the study section for whom the people on the study section may not have the expertise, they will frequently call in additional ad hoc reviewers. And that can be, that can be as many as 10 to 20. I don't know, Matt, how about you?
That sounds about right. I mean, yeah, it's like study section members sign up to review. I think it's like, I know it's 3 panels per year for 5 years or 4 years. I can't remember. I think 5 years. Anyway, some point in there, a member may have to miss a session or whatever. And so they may bring in an ad hoc to fulfill that expertise, or they may get an application, you know, that is with a unique population or a really different method for which there isn't adequate expertise on the study section. So they might bring in 1 or 2 ad hocs for that. So the number usually winds up being 20, 30. I guess what's embedded in there, which I think is a really important point that I'm not sure we emphasize, but it sounds kind of funky, but it's true, that all of those members of or all those individuals present at that study section meeting get to weigh in on they enter an impact score. And so the 3 reviewers that have done a deep read will present for that whatever 10 minutes before discussion on the proposal, and then the other panel members who haven't most likely read the proposal, maybe just looked at the Ames page, that's a key point, will also get to ask questions. We'll listen to all those comments, and then they'll enter an impact score, and then all of those get averaged together, and that's your impact score. So the key point that I take from that, from a functional perspective, and why it's actually, I actually bring it up, is you need your reviewers to be excited about your proposal, right? If so, because they just go in there like, yeah, this is pretty good, like everything's solid, you know, cool, fills a research gap, next reviewer. The other reviewer members on the panel, they're leaning on them, they're depending on them to differentiate between a 2, 3, and a 4. And that's where a lot of the good grants fall. And 4s don't get funded. 3s usually don't get funded. You need 2s for the most part. So you need somebody to say, this is better than just good. This is why it's exciting. And so I think about that when I write my proposals. I think about how to say, this is really important. This is why it's really important. You should care, because they have to convey that to the other reviewers, and they also have to convey it to those other study section members who have not read your grant and may just read your aims page. So also make sure your aims pages are very clear and digestible.
Okay, Jess Myers has a question here. Matt, you touched on this, which is just talking more about the policies, the change in policies related to inclusion of women and minorities.
Yeah, are you asking?
Do you want to take it?
No, but I'll yeah, so I would encourage people to look at that, link, and it specifically references, I don't know. Yeah, we're being recorded, so I'll watch what I say. It specifically references some descriptions that have come from the new federal government about how we should think about these things. But my read in looking through the details on that, as I mentioned before, is that you still are expected, as we are as scientists and as we always do, to be inclusive in your research, and then to justify those inclusions with an evidence-based argument. I don't know what else to say on that. Maybe there's more.
Yeah, Jess, do you have a specific question about this?
I was wondering if there were any changes to how that actually looks logistically for when I submit a grant. I haven't had a grant submission since these policy changes have occurred. So I just was curious if there is any change to like the form that's filled out, or how that actually works on the kind of nuts and bolts logistics of it.
Mm-hmm.
The
Yeah.
form has not changed. What you say maybe has changed depending on the kind of research you were doing before. I will say from my own experience, my interactions with NIH has been, unless there's a clear reason to only focus on one group that's aligned, and that justification is aligned with the current administration's priorities, you must take all comers, right? But you also, so that really, you're basically saying we're taking everyone, we're taking, racial and ethnic minorities, and we're taking women, and I mean, what I've done is just simply say, we expect that the population that we will recruit will align with the population demographics for me, it's of smokers in the Kansas City region, right? And so, 12% of adult smokers in the Kansas City region are African American, X% are Hispanic. And so we will do our best to align with those demographic characteristics of the population. That's how I've handled this.
Mm-hmm.
My read of this revised policy is, they're basically saying you have to include everyone. And if you're going to exclude people, you got to justify why you're going to exclude it. And they provide 3 situations where prior studies suggesting the existence of significant differences, prior studies supporting no significant difference, and prior studies neither supporting nor negating significant differences.
That's super helpful. Thank you.
Yeah.
Christina asked a question around changes in the terminology. There was that list of words like that should not be included. I haven't seen like a revised list or any changes to that particular list. I don't know if others have, but I have not.
Yeah, the NIH director swears that there's not a forbidden terms list, although we've all seen it, right? But there's not a NIH directed forbidden terms list. But Christina, do you have a question about specific terminology? that you're worried about?
I think it was just referring to different groups of people, since I feel like almost every group was on that list, including women.
Yeah. I don't have a good answer for this. I mean, obviously they're telling you that, I mean, sex as a biological variable is something you have to address within your proposal. So, and it's something that it's mentioned in study section at the review. So.
But it always has been, right?
Yeah, it
Like,
always has been. That's not a change.
right.
But I have certainly gone through the exercise of removing forbidden terms from my grant. So I think the guidance on this is confusing. And I think the best approach is to talk with, before you submit, talk to a PO. And again, the POs are offering different guidance on this, but it's based on their best informed, I'm not going to say guess, but their best informed opinion based on what they're seeing as getting kicked back and where clarifications are needed. So I would say talk to your PO. I also think that there's Lisa Cox, if you have access to this and can pop it, you might not, but it's the NIH priorities, right? Document. I mean, that very clearly says there are priorities in key areas, right? And that includes related to groups who have disparate health outcomes relative to other groups. You can't just describe the disadvantage. They want action-focused research that's saying, okay, there's this disadvantage and this study and that disadvantage is justified, and our study is going to do something about the disadvantage.
I know we're getting, oh, go ahead.
I was just saying thank you.
Okay, so Lisa just put the link to the document in the chat. Thank you, Lisa.
And I'm looking for a second one. There's actually two different ones that have come out, and they are similar but not identical. One has more different sort of priorities than the other, but they're not wrong. I mean, they're not, in conflict with each other. One of the things in terms of a grantsmanship perspective, while you are removing potential red flags, you also might want to be thinking about opportunities to incorporate some of the lingo from the priority statements when possible.
Thank you. I want to take a minute to thank our presenters. This was a heavily attended presentation, so we appreciate it. And then we have the recording as well, so that'll get posted shortly. I do want to call out that Julia's put a link in for the Frontiers mock study section. That'll be hosted on December 4th, so definitely take a look at that link if you're interested there. And again, thank you so much. This is such an important topic and a movable one is what at the moment as well. So thank you for that, and hope that everybody has a good rest of the day.